Well, we're joined now by Professor Rob Galloway, who's an emergency medicine consultant and medical advisor to the NHS Support Federation. Professor Galloway, thank you for coming onto the programme. The Prime Minister has called these emergency talks. It does suggest that the government is now treating this as a crisis.
The first most important thing is to acknowledge there's a crisis, and that needs to happen, because all we've heard so far is that it's just busy. It's not busy. I've been working accident emergency for 22 years and speaking to colleagues up and down the country, we've never seen anything like this.
And I know we don't want to get into the specifics about patients that you've seen, but just give us a sense of what you, your colleagues, contemporaries around the country are seeing. What are the worst sort of scenarios?
Yeah, so this is, a problem up and down the country where patients are waiting in corridors for hours and hours, and then when they get into A&E cubicles, they can wait for days to get into hospital beds. Often this isn't a problem because of what's happening in A&E. It's a problem played out in A&E, because they often can be seen quite quickly in A&E by A&E doctors, but then the ongoing care which needs to be done in the wards is delayed. And I say it's not just hours, it's days now. And Chris Moulton did a paper last year showing that for every 82 patients who are delayed by up to 6 to 8 hours getting out of A&E onto a ward, an extra patient dies within 30 days. And that's how the Royal College of Emergency Medicine have worked out that the delays going on in emergency care are causing up to 500 unnecessary deaths. And to my mind, that's a crisis. And so if we had 2 planes crashing with 500 people in, there would be a COBRA meeting. They'll be doing absolutely everything they could to try and solve the problem, not just saying it's busy.
Well, they have held an emergency meeting today to put to you what the government's now saying. As a result of that meeting, the Prime Minister says that it's one of his top 5 priorities to reduce NHS waiting lists. They're talking about £14.1 billion of additional funding. Is that enough? Is that going to solve what's going on?
So I talked about my article in the Mail about the things they need to do immediately now, and then also in the medium term. Immediately now, we need to put the NHS in a critical incident mode, and we need to get additional hospital beds. And the way to do that is to create additional social care beds, because the problems are further on in the hospital. So we can't get patients out of accident emergency because wards can't get medically fit for discharge patients out of the hospital. And that's because of the failures of social care over the last few years. And we could, with help from the army, for example, or from paying extra for social care workers and carers, open up emergency social care settings. So we set up the Nightingale hospitals during COVID, and they were the wrong ideas because they needed doctors and nurses, and we don't have them at the moment. But we could set up Nightingale social care settings to free up the hospital beds so our patients can flow through the hospital.
So what you want to see is some sort of immediate plan of action, as it were?
We need an immediate plan of action, because the patients we are looking after are coming to harm, and they are dying because of delays getting them out of the accident emergency departments. So we need immediate actions this week, which will help our patients. Then there's the medium-term plans, and yes, staffing is the absolute key. We have had, people blame COVID and the flu. This is a problem which has been brewing for 10 years with reduced investment in the NHS, reduced investment in staffing, and we don't have the staff comparable to, say, European countries. A number of beds, for example, we've got half the number of beds that Germany have got per 1,000 population. We need to have a radical look at how we fund and plan the NHS, because it is not working for our patients. And we've got patients who spent all their lives paying their taxes so that when they need the NHS, it'll be there for them. And at the moment, it's not.
OK, very clear. Professor Rob Galloway, thank you very much for joining us tonight.